Beautiful. If you're navigating menopause, you've probably have heard quite a bit about hormone replacement therapy and HRT, and you still may be as confused as you were when you first heard about it. That's because every doctor seems to have a different idea of what to do and how to test for it, and but none of them actually explain to you what the alternatives are because they don't really know. So that's what we're going to talk about today. The natural approach, a holistic natural approach, is fully under your control. It involves diet, supplementation, exercise, all kinds of holistic ways of doing things. And what they have found in the scientific literature is that it's as effective, maybe more effective, than HRT. And it's something that is fully under your control, which I love, and that's what I was looking for when I was going through the worst of my menopause. And you don't have to depend on the pharmaceutical industry or your doctor to get a prescription because you can do it yourself. And we're going to explain to you how that works. All right, let's dive in and be sure to subscribe today so that you can stay tuned for all the important videos and information that we provide as part of this holistic menopause hormone community. All right, let's dive in. All right, so let's start out talking about the traditional way of HRT testing and application. And this will give you an idea of why I decided to do a more holistic and more comprehensive approach, because the typical hormone evaluation is very limited, usually focused on estrogen and progesterone, completely overlooking all the other hormones that are part of the menopause experience and can actually cause problems afterwards. And I'll explain that as we go through here. But they overlook thyroid hormones, androgens, and cortisol, which come from your adrenal glands, which are really important part that impact your energy level, your metabolism, your mood, your bone density, and so much more. The other thing is that when you get HRT, just like with any medication, it's made in a specific level. So if you don't fit into that level, let's say it's 0.5 and 1.0, whatever it is of the estradiol, you may fall somewhere in between that, what you need. So you're either going to get too much or not enough. When it's just right for you, that's the women that feel really good on it because somehow or other they got the dose that's right for them, but that's pretty limited. There's also a lot of fluctuations and on the blood tests, like one day it may be higher than another, especially during perimenopause at the early stages of menopause, and then it doesn't really accurately reflect, and that also tends to lead to over or under treatment. And then the route of administration. I have so many female patients that either they're getting oral administration or the transdermal, which is the patches, and you maybe have heard of those. The oral administration is the one that actually has more potential for problems because it goes through the digestive system, the liver, and it can lead to more issues than the transdermal, which bypasses the liver. So it affects the way it's metabolized. I won't go into a lot of detail, but that definitely has less risk in the transdermal mode. The other thing is that you have a potential for estrogen dominance. That's the balance between the estrogen and the progesterone, especially when you're taking the synthetic version of the progesterone in a pill form. It does not get utilized very well, and you can end up with having too much estrogen compared to the progesterone, and that's when you end up a lot of times having weight gain, breast tenderness, mood swings, and other symptoms that are associated with estrogen dominance. So we're going to get into a little bit more about how the current research supports a more natural approach. So one of the things they found is that weight loss, exercise, and a healthy diet tremendously lowered cholesterol and reduced the incidence of heart disease much better, even in women who stopped HRT. So those seem to be more important factors because a lot of times they want to put you on HRT to reduce the heart disease risk, but that's just a minimal prevention. These other factors are much more important. And a low-fat diet helped reduce breast cancer mortality and supported heart health more than HRT did. The other thing with breast cancer that I rarely see promoted, but I've known about it for many years, it was in the literature probably from the 90s, that if you exercise 3 times a week, you tremendously reduce your incidence of breast cancer. And I don't hear any doctors talking about that. And another thing with breast cancer is that the vitamin D, when you get it to the right levels, over 60 to 80 nanograms per milliliter in your blood when you do a blood test, you can reduce your incidence of breast cancer by 80. That's huge. And the HRT is minimal compared to some of these other natural factors. That's why I test everyone for vitamin D levels. If you haven't been tested, that's part of our program. And it's really essential for your well-being. Breast cancer is only one of the things that it does. And here's another important thing about a lot of doctors want to put you on HRT because it prevents bone density issues. And that's true, it does help with that. But the facts are that these other factors like vitamin D, magnesium, K2, boron, zinc, protein, and collagen, and weight-bearing exercise actually are much more important. And so many women that I've worked with that are older, in their 70s, 80s, even up to the 90s, they've never been told about all these other factors. They were put on HRT and told to take calcium, which is really just not enough to support bone density. Then they end up on these bone building medications, which is also has its own risks, when all they needed the whole time was to improve their vitamins, minerals, increase the amount of protein they eat, which I find most women are not eating enough protein, and doing these weight-bearing exercises. Much more important for your bone health than HRT. Another example is weight gain and its connection to hormones. And many people, women on HRT, gain weight and they blame it on the HRT when really it's not because of that. But it can be related, but it's not strictly because of the HRT. So estrogen dominance, like I was saying earlier, that if you have too much estrogen compared to the progesterone, so the HRT may be a reason that happens because you're absorbing the estrogen from the HRT and not the progesterone. But a lot of times the progesterone needs to be administered in a different way, a more natural kind of progesterone. It works better when it is intraoral. There's an oil that is intraoral that works really well. And then on the skin, so either transdermal or the progesterone that you put on your skin for 3 weeks out of the month. And that's what I use, and it actually helped quite a bit. The other thing is the thyroid hormone. And like I was saying earlier, that a lot of doctors, when they're putting patients on HRT, they're not looking at thyroid hormone. And when you have a low progesterone, like when we talk about with the estrogen dominance, it actually locks up your thyroid hormone, and that it won't allow it to function normally, and that you can end up gaining weight from that. Or you could be deficient in certain vitamins and minerals that are necessary for thyroid functioning. And I do have another video on the YouTube site related to this. Okay, so you can see for a couple of examples that I gave you that looking at the whole body care, the adrenal hormones, the thyroid hormones, caring for the whole person actually does give a little more benefit significantly than just being on HRT. So that's how you get your best results. So let's look at a couple of examples in terms of the supplementation that we use to help balance your hormones. That's part of our natural program. So maca is one of them, and it's a very important one because there's some really good research on maca, and specifically on the kind of maca that we use called feminescence. They have a specific one for reproductive years for younger women. They have one for perimenopause and one for postmenopause. And they're like a tuber, like you see in the picture here. They look like turnips or something like that. And they're actually highly nutritious. And when you get the maca that we recommend, it's been formulated in such a way to be easily digested and absorbed by your body. So for general health, it supports your normal hormone balance. It supports your adrenal hormones, which take over a lot of to give you a lot of benefit when your estrogen goes down. The adrenal hormones actually help quite a bit to help that balance. And it helps a lot with energy levels because it's very nutrient dense, the maca. It helps with menopausal symptoms. It reduces hot flashes, night sweats, improves libido, sexual health, and vaginal dryness, which are a lot of the big issues that seem to start up very early in the menopause period. It supports mood and an improved outlook on life. 84% of women experienced a symptom reduction in anxiety and depression within 2 days to 8 weeks, and on average about 3 weeks. That's really huge because that was one of the problems that I personally had, was very severe anxiety. And the next herb that we're going to talk about was one that I started very early on and that I've had really good benefits with many of my patients. Okay, how about heart, bone, and mental health? So it also supports that normal hormone balance, and it's one of the few nutritional formulas that actually improve that bone density. And so you don't have to have HRT to do that. The maca actually picks up that role. It also supports a healthy body weight. That's really great. Healthy cholesterol and triglyceride levels. So it doesn't increase. So those are things that often happen when women don't use HRT, and the reason why they put them on HRT. So the maca actually can take up that role. All right, let's look at the ashwagandha. So this is the ashwagandha product that I do recommend, the Nutri-Rise. You don't have to get this one, but I do recommend getting an organic and making sure that it has the extra strength. This is really a beneficial herb, and the actual name is Withania somnifera, if you've ever seen that before, but they're called ashwagandha. And it's what's called an adaptogenic herb. And it helps to balance all of your hormones naturally that occur during menopause. And it lowers the cortisol levels, which is our stress hormone. And I don't know anyone that doesn't have stress that live in our society, right? Then it helps reduce that belly fat and improve your bone loss. So the cortisol, weight gain, anxiety, poor sleep, and bone loss all show improvement with ashwagandha. And studies show that ashwagandha reduces the cortisol levels by up to 30%, which is really significant, and improving your resilience, your ability to bounce back from having a stressful life, that you can handle it better and you don't feel so overwhelmed by things going on in your life. And it helps to reduce the bone breakdown. So that, along with maca, work really well together. The ashwagandha is a little more powerful, I have found, with the anxiety and depression and cortisol, but the maca is more overall and has really good support for the bone density, and that has really benefited me. The ashwagandha also supports thyroid function and helps to boost your metabolism and energy levels, and balance your T3 and 4, which are the thyroid hormones that are really needed to be activated in your body to improve your energy and metabolism. And one of the things that I find, because traditional doctors don't include thyroid hormones automatically often in your testing for menopause, they often get overlooked, and a lot of women end up with Hashimoto's, which is an autoimmune disease of hypothyroidism, and these can all be prevented with proper nutrition and with a lot of these holistic techniques. It also increases testosterone, which helps with your muscle strength and supporting muscle so you don't end up with sarcopenia. And like I mentioned earlier, it's very important as part of your holistic care to increase your protein and good fat and reduce your carbohydrates. These are lifestyle changes that really support anti-aging and support you during menopause. So the bottom line is you don't need HRT in the same way that we have been thinking about it, that it helps to prevent cardiovascular disease, dementia, bone loss. All of these things actually are able to be done holistically without HRT, and probably better, like we were talking about with the bone density. Yes, estrogen is a component, but actually it responds better to making sure you're getting the weight-bearing exercise, that you're getting all your minerals, vitamins and minerals, and calcium. Calcium is just one of the minerals. You need magnesium and zinc and boron and all these other things. And when we supply all of these nutrients and lifestyle, it actually works better than just HRT. And when HRT is done in combination with this holistic program, it actually can be very beneficial, but you still are taking the chance that you're getting too much or too little, like we were saying earlier, and also about when you started. Like, just for example, with dementia, if you start HRT early, it's supposed to help with dementia, but if you start it late, it actually can promote dementia. So how do you know which is which? You don't really know, because nobody knows. They're still doing research on that. But because you can increase your estrogen and improve your hormonal balance without HRT, why would you want to do that? I mean, the medical profession and the pharmaceuticals, they're not going to tell you the other side of the story. They're only going to tell you what they're promoting, right? So I'm telling you how you can do this with eating a balanced whole food diet. If you increase your protein, decrease your saturated fat, but increase the healthy fats like olive oil and fish oil, increase your fiber, decrease your regular carbohydrates, stay active with the strength training and cardio, getting enough sleep, and reducing stress helps a lot with inflammatory responses, which is one of the reasons why we have a lot of these other autoimmune diseases and dementia. They say now can come from having an sugar imbalance that causes inflammation in your brain. So supporting your hormones naturally with these proper nutrition and these other lifestyle changes, and using herbs like maca and ashwagandha, are far more beneficial to you, because it allows your own body to create its own balance. And that's what we really need in our lives to stay healthy, reverse our biological age, and improve our menopausal symptoms. So I would love to hear your experience. What is your story? Is this something that you have been trying to figure out? Have you tried some of these herbs? Have you been on HRT and experienced the weight gain and some of the other issues that some women experience? I'd love to hear your story. Please put them in the comments. And if you'd like to join our holistic community and learn more, I put a link in the description so that you can join us and subscribe to our channel so you can get the latest information about holistic well-being, and reverse your biological age and feel really great every day. And sign up for our masterclass on holistic menopause with topics like brain fog solutions, and we're getting ready to do that. So if it's not in the description, just join our community and we will let you know when that next masterclass is going to be. So don't forget to subscribe and like this video, and I look forward to seeing you again.